I'm now pleased to welcome Maayan Hoffman, news editor of the Jerusalem Post, who will interview Ohad Arazi, Chief Executive Officer of Zebra Medical Vision, for a discussion of how early detection of chronic disease can be done through artificial intelligence.
Well, Ohad, we are very glad to have you here today at this very unique conference. And I was hoping that we could actually just get started by you telling me a little bit about Zebra itself and how you're using artificial intelligence to screen large populations for chronic disease.
Absolutely, Maayan. So Zebra Med was founded in 2014. We're headquartered in Israel. We're about 95 people strong today. And we're the market leaders in imaging AI with an industry best 7 FDA-cleared solutions across radiology, cardiology, oncology, orthopedics, and bone health. And since day one, ZebraMed has been on a mission to transform patient care by teaching computers to automatically read and diagnose medical imaging studies. I'm sure you know medical imaging is already established as one of the most critical and influential domains in healthcare. Over 3.6 billion imaging scans are taken across the world globally, dealing with nearly every type of condition. And ZebraMed is looking to empower healthcare providers to manage this exploding workload and ever-increasing complexity of medical imaging without compromising the quality of care through the use of AI and machine learning. And one of the things we're extremely passionate about is leveraging that in population health, like you said, to shed a light on chronic diseases, which are typically underreported. 90% of the 3.5 trillion spent annually in the US on healthcare is for patients with chronic conditions. And yet, much of the focus of medical imaging has been on acute conditions, given the fact that radiologists are pressed for time and are often forced to focus only on what matters most. And that's really the role that AI can play, because there's so much more to the data above and beyond the critical finding itself. And we use AI to mine pre-existing data to identify patients who would benefit from interventions that could contribute to their health or to reduce the risk of disease, reduce hospitalizations, improve outcomes through early detection. And that ultimately not only gets better clinical outcomes, but also saves the healthcare system significant costs by identifying diseases that are commonly overlooked or that would benefit from an earlier intervention.
Right, it makes a lot of sense. And you mentioned that $3.5 trillion price tag. So I imagine that this is something in the long term that's going to save trillions and trillions of dollars. Now, you talked about chronic diseases, but let's define those a little bit. What are the diseases that you can detect today? And what are some of the specific benefits connected to those diseases? Give me 1 or 2 examples.
Yeah, if we look at data sets from chest CTs that are performed to diagnose acute conditions, we subsequently analyze those same cases in parallel by an algorithm that can identify a wide variety of chronic conditions. And a few ones maybe I'll touch on are vertebral compression fractures, which are a leading indicator of osteoporosis, coronary calcium scoring, which is an indicator for the risk of cardiovascular disease, emphysema, lung nodules. There's quite a few more. I'll try to bring that to light for you in a moment. Imagine if I get off of a long international flight and I experience chest pain. So the emergency room would send me to do a chest CT, and the radiologist would interpret the exam and focus on confirming or ruling out a diagnosis of pulmonary embolism, which is an acute condition that can emerge on long international flights. But what they would certainly not do in that case is spend more time reviewing the exam to measure the degree of compression in my vertebra as an indicator for osteoporosis, or to quantify the degree of calcium in my coronary arteries as a leading indicator for coronary artery disease. And these are conditions that are not routinely reported on by radiologists, but AI can help. And maybe to your question, I'll double click on osteoporosis for a moment. Nearly half of all women and a quarter of men over the age of 50 will suffer an osteoporotic fracture in their lifetime. The cost of fragility fractures in the US is estimated to be $2 billion annually. This disease is often referred to as the silent killer and is the most common preventable cause of fractures, causing more than 2 million cases of broken bones in the US. And vertebral compression fractures, basically minute compressions in your vertebra, are an indicator that you're developing osteoporosis. But these conditions are typically underreported. Only about 30% of moderate to severe cases of compression fractures are reported on a global average. With AI, we increase detection to over 90%. Wow. And we know that through early intervention, you can have great outcomes in preventing osteoporotic hip fractures in high-risk individuals.
And I imagine that also impacts their quality of life.
Exactly. By treating patients early, through medication, physiotherapy, and lifestyle, it empowers both the physicians and the patients, right? And that can substantially drive down mortality and morbidity.
Amazing. Now, I mean, we can't really have a conversation about anything medical nowadays without thinking about the novel coronavirus, about COVID-19. Tell me a little bit about what your company was doing during the crisis and how you think the crisis will influence where we go from here with regards to AI technology.
Yeah, dealing with population health has actually become even more critical since the breakout of COVID, because the entire health system was required to really develop tunnel vision to only deal with what matters most. And as a result, many conditions that are not acute were not getting diagnosed or treated. And in many cases, exams were getting deferred altogether. I liken it to shining a flashlight in a dark room, right? I mean, when you're focused on one thing, you can see what's in the spotlight, but you're certainly missing things that are around the edges. And a very good example of this is mammography. With the outbreak of coronavirus, annual mammography tests during lockdown were postponed or canceled globally. And I'll share an amazing data point. Every day from mid-March to mid-May, and that started up again in the fall, an average of 94,000 mammograms were deferred daily. Wow. That means that just in that spring period, almost 6 million patients experienced increasing anxiety waiting to be tested and ran the risk of missing an early detection component of their annual screening as a result of these deferrals. And AI can help solve that. And that same phenomenon is happening again now with the second and with the third waves, as the health system needs to refocus on COVID again.
Wow.
Generally, I'd say that at a time when personalized medicine is becoming more prevalent, using precise algorithms in the development of AI solutions is really what can be gained to optimize patient outcomes. And if we want precision healthcare for COVID, you need to examine patients more closely. And so we developed an algorithm that does AI analysis of lung CT scans, where you can see early onset of diseases and changes in the diseases over time. So imaging AI allows you to see the progression of COVID pneumonia in the lung and help doctors make a decision on whether or not the patient needs to go to the ICU or needs a ventilator, or if their condition is not an urgent.
That's actually so important, especially because when somebody becomes intubated, we know there's a lot of long-term effects from that as well, not just the action of intubation.
Exactly. I think that, especially in the early days, doctors were often needing to make decisions blind. And this isn't about, classifying a patient as COVID, non-COVID. I think the PCR test has been proven to be very effective, but where imaging AI can help is to help prioritize the patients that need the care the most by indicating to the physicians what is the disease progression of the patient. And therefore, they can make a more informed decision on how to deploy their most valuable resources, right, which is ICU and ventilators and hospital beds.
Amazing. Well, Ohad, thank you so much for being with us today. It was really enlightening, and I hope that we move forward using this technology to better and brighter days as we begin to inoculate here in Israel and around the world and move past COVID-19, but take the benefits of that for tomorrow. Thanks so much.
Excellent, man. Thank you very much. Bye-bye.